We start here. The Public Servants Association says the death of an intern doctor at Prince Mshiyeni Hospital in Umlazi, Durban could have been prevented. Dr. Alulutho Mazwi died earlier this week, allegedly after being forced to report for duty at the hospital while ill. Newzroom Afrika's Silethiwe Ndlovu is outside the hospital and joins us now live with more details. Silethiwe, the PSA says Dr. Mazwi's death could have been prevented. How so?
Certainly. Well, the PSA says that the death of the intern doctor, and this is now Dr. Alulutho Mazwi, could have been prevented, especially because it seems as if he was sick prior to his death. And we understand that this is something that he had communicated to some people at the hospital regarding the fact that he was unwell. So the PSA says that not only was he overworked, but it also seems as if there was a bit of negligence that came from the hospital. And I'm just going to bring in the PSA right now to speak to us more. Thank you firstly for your time this afternoon. Firstly, let's just talk about what transpired here at the hospital on Monday.
As PSA, firstly, we send our condolences to the family of Dr. Mazwi. We are very disturbed. We have been on record many times that in this hospital, people are being ill-treated. What happened on the 12th, it's very painful because doctor reported that he was not well. He has not been well, and some of this has been caused by the way he was treated. This just started in January at the age of 24. When he reported that he was not well, he was instructed by the supervisor she said he must report for duty, and he collapsed and died in this hospital. It is for this reason, as PSA, we have called for the suspension, and we're very disturbed that we're expecting that the office of the MEC will be able to attend to this hospital. PSA is on record raising numbers of issues in this particular hospital, where you've got about 28 nurses that are on medication for depression due to ill treatment. And we had discussions, we visited and met with the interns. You know, the report that we received, some of these interns, they are saying it's a matter of survival for the fittest. Whenever they report this abuse and ill treatment, there is no action that has been taken. Interns are left to work alone without supervision, which are against all the laws.
I hear you're touching on something actually that I want to go to next. We are being told that he actually collapsed twice prior to his death, and this is a conversation that is coming from one of his friends. I just want to talk about the conversation that you are having with his mother. Firstly, how is his mother doing, and what is the conversation there? What are some of the details that he had relayed to his mother before his passing?
Because as PSA, we are concerned. We know that this was the only child from the Mazwi family. A young doctor came from the Eastern Cape. We know when I was talking to her mother, you can feel the pain because he was the only hope. He was the only breadwinner at home. Now is no more. And her mother told her to say, if you're not well, don't report for duty. It was not the first time, because some of these created chronic conditions. It has been caused by the bullying tactics. This hospital is known. Many of the interns and doctors and those people that have graduated from being intern to be medical officers, they have been ill-treated, but there is nothing that is being done. HR that's supposed to have an helicopter view, provide advice and guidance, they're not doing anything. We are saying to the minister, please visit this hospital, be able to intervene. We are saying to the president, please visit this hospital. We're calling for the justice. Every society must call for justice for Dr. Mazwi, and Department of Labor, we have engaged the Deputy Minister, His Excellency Jomo Sbiya, to come and visit this hospital, and different stakeholders, they must come, and the community of Umlazi. Enough is enough.
The Department of Health released a statement just a while back. Do you feel that there's any accountability that comes from the Department of Health? Of course, you're mentioning that there's a number of issues that continue to plague the hospital. So do you feel as if there's any accountability coming from them?
The only challenge when you write a media statement and you don't have experience of how people are suffering, if you look at that statement, they are saying nothing to say we have taken action. It's an allegation against this supervisor. The supervisor have been placed on precautionary suspension. In that statement, department is saying nothing. And we believe that they have not done enough to reach out to the family. And also to this intern, they are really disturbed. They can't work and assist patients due to these particular challenges. We are saying, department, enough is enough. We have sent them, we have warned them. We warned them when there was no life that has lost. Now someone has died. We're talking about a doctor who has been there for 6 years. African children are being abused by our own government. That's why we are saying they must be able to do something. So it is the responsibility of the Human Rights Commission. We wrote to them. We wrote to Public Protector. They are not responding. So what we are saying, those interns are even afraid because they are still intimidating them now. They don't want them to talk to the public. They don't want them to talk to the unions. This has become a prison. So this is why as PSA we say we're not going to stop. We're just speaking the truth.
And lastly, before I let you go, again, you spoke of some of the issues that are of great concern when you're talking about the hospital. And it seems as if from the conversations that we've been hearing, there might also be an issue in terms of staff shortage. Talk to me about what this means where you find that there's a doctor that has now lost his life. What impact does that have when you're looking at the health department specifically for this hospital?
It has huge impact because to train a doctor, it takes you 6 years. The department seems to not care. The problem with shortage of doctors here and nurses is that you're looking at Umlazi. They cater about over 500 population. These interns become medical officers. So this matter of this Dr. Mazwi, it affects service delivery. Go to Mshiyeni, inside Mshiyeni. It's unfortunate that the media, they will not allow the media to go inside. Our people are suffering inside here. Then you've got a supervisor who continue to work even after this incident. We are saying it's not our baby that there is a shortage of budget. People should not die because most of these people that have got medical aid, they are not attending to this particular hospital. And the prim and everyone, they must be able to come. Every South African must call for justice because in KwaZulu-Natal we have been ignored. The system of health has really collapsed. It's not only the issue of Prince Mshiyeni. You go to Ngwelezane, you go to Dr. Priska Isasem, you go to Escort, you go to Newcastle. It's a crisis everywhere. No one should protect a system that has collapsed. KZN has always have a good system. It is for this reason. We are saying if the minister is unable to attend to these issues and MEC, then someone must take in. They must step aside so that people who are capable to lead this department must be able to do that. That's what our members are saying. The MEC, the minister, if they can't attend the issues of KwaZulu-Natal, must step aside. It is the call of the people. We must call for justice. Nelson Mandela never went to prison for us to be oppressed again. This is the oppressions that Mandela talked about to say never and never again. We are seeing this oppression. It must stop now.
Thank you so much for speaking to us. That's Ndlovu from the PSA speaking to us, not just about some of the issues that seem to be of great concern when you're speaking about this hospital, which is behind me, but also just some of the challenges that were faced by that intern doctor, Dr. Alulutho Mazwi, who has now unfortunately lost his life. The conversation that we had earlier on with one of his friends is that he actually collapsed twice prior to his death, and it seems as if he actually communicated that he needed to see a doctor on the day when he passed. And we are actually going to be in conversation with him a bit later on, just so that we can get more details in terms of what really transpired leading up to those hours where Dr. Alulutho Mazwi passed.
Silethiwe and Ndlovu with that update. What an unfortunate incident. Hopefully someone is going to get to the bottom of it all.